Hi, still on your disturbances in locomotion. Our focus for this discussion is your musculoskeletal trauma. Just as a disclaimer, there are related content which may be disturbing to some individuals due to the use of some photograph which would contain traumatic injuries. So this is intended for the purpose of learning. Okay, this is only intended for student nurses and not supposed to be viewed by other individuals who would find it uncomfortable. And this specific photograph would belong to the medical professionals' websites and then case studies to where they are found and retrieved from in the internet. So no copyright infringement is intended. Again, this is only for educational purposes. Let's talk about sports injury. So when I talk about your sports injury, I'm referring to contusion, strain, sprain. So these are the most commonly reported injuries even at school. So, and then ankle is your most commonly sprained joint. Now, contusion. When I talk about contusion, it is a bleeding into soft tissue as a result of blunt force. Okay, the skin would remain intact and the patient would manifest with hematoma. Okay, other than that, your patient would have swelling and discoloration of the skin. So as shown on the picture on the right. Then you have your strain. So class, when I talk about strain, this refers to a stretching injury to a muscle or a muscle tendon unit. So strain, the problem is muscle or muscle tendon unit. The manifestations would include pain, limited motion, muscle spasms or weakness, and then you'll have your swelling. So your patient may have possible muscle weakness, okay, because of the pain experience that they would have. So notice where the pain is, okay, or notice where the injury is. So the injury is usually between the muscle and the tendon. Then you have your strain. Sprain. When I talk about sprain, this would involve a stretch or tear on a ligament surrounding the joint. The manifestations would include loss of functional ability of the joint, the feeling of a pop or tear, discoloration, pain, and then rapid swelling. Okay, so the keywords there are pain and rapid swelling, which are usually seen on a patient with sprain. So again, just to differentiate, a strain would refer to an injury to the muscle or to the tendon. Recall MTB, muscle to bone. And then you have your muscle would be attached to bone with tendon. And then you have your sprain. Okay, so your sprain is an injury to your ligament. Okay, take note of that ligament. Now, what is our management for these patients? So you'd have your rise, okay, your rest, ice, compress, and elevation. So resting would mean recovery. Okay, now class, when I say rest, that would mean not moving the joint. And when I say not moving the joint, that is usually done for prolonged period of time. Okay, done for prolonged period of time. Then you have your ice. Ice applied to the painful area, such as your cold compress, is intended class to promote relief from pain. Okay, so your ice is applied usually for 20 minutes and then done every 2 hours. Okay, again, the duration of application is every 15 to 20 minutes, and then the frequency is every 2 hours, and that would be good for the first 24 hours only. However, on the next hours, okay, after day 1, you would need to use your warm compress. Your warm compress class is intended to promote the blood flow going towards that area. Blood flow towards the area of injury is intended to promote healing and recovery. Then you'll have the application of compress. Okay, so when I say compress, okay, that would be a little pressure. So class, compression is usually done using your elastic bandage. So your elastic bandage here, class, are twofold purpose. One, to stop movement, okay, or to minimize or to prevent movement. And then the second one is to prevent your edema. Okay, to prevent edema formation on the peripheral aspect of the injury. Then elevate your injury by resting above the level of the heart. So the purpose of that again is to decrease the edema of your patient. Because if your patient would be having edema, okay, that would impair also the healing process of your patient. Increase the pain, increase the discomfort. So again, for the management for your contusion, sprain, and strain, you go back to your rise. The diagnostic test for this would involve the use of your ultrasound, X-ray, and MRI. Okay, now class, X-ray and MRI, they are not actually intended to diagnose, okay, your contusion, sprain, and strain. By the way, sorry, ultrasound and X-ray are not actually intended to diagnose your contusion, sprain, and strain. For example, your x-ray would be able to diagnose your fracture. So in injuries like this, your x-ray is used to rule out for the presence of fracture. Your ultrasound class will be able to detect the presence of fluids. Your MRI, on the other hand, you'll be able to detect a tear on the ligament or tendon. Okay, because your MRI would be more detailed when it comes to the images. Now, on the medications given to the patients, you have your NSAIDs. Then you also have your acetaminophen. In our setting class, the common medications that we give to our patients are our mefenamic acid. Mefenamic acid is usually given every 8 hours for 3 days, and then the doctor would also prescribe an accompanying analgesic in the form of your celecoxib, which is a COX-2 inhibitor. Okay, that's the usual management that I would usually encounter in the ER setting if my patient would have your sprain or strain. Okay, and then class A, if that would usually involve the elbow, we would usually place our patient on arm sling. If that would involve the ankle, we'd usually place our patient on elastic bandage. So again, the focus of treatment is immobilization, surgery, and physical therapy. The difficult task here is that you need to educate somebody, let's say for example a high school student, that he or she cannot join the games for the next 4 to 6 weeks because of the need for immobilization for the recovery of the joint. Okay, so you need to properly educate them, because remember, at this age, okay, their focus would be on their sports, and their focus or source of gratification will be from the engagement with others and the sense of achievement by winning on those events. Then you would have your physical therapy. Okay, so class physical therapy is intended for your patients to have movement on. Okay, physical therapy is intended for your patient to have recovery on their daily activities. Okay, so physical therapy is usually done once immobilization is already removed, okay, or is already off. So what is our nursing care for this patient? So you have your acute pain and impaired physical mobility. Okay, so acute pain related to inflammation, acute pain related to injury. Then impaired physical mobility related to the pain experience of your patient, and related also to the inflammatory processes, okay, or inability to tolerate movement. Okay, so class, these are the usual nursing diagnoses on sports injury. By the way, surgery is rarely done for this procedure unless class the orthopedic surgeon would really warrant for a surgery to be performed. Your next topic is fracture. Okay, now class, when I talk about fracture, okay, it is technically defined as a break or disruption in the continuity of the bone that often affects the human needs for mobility and sensation. Okay, again, it would affect the human needs for mobility and sensation. The most common cause class is your motor vehicular conditions or accidents. Okay, MVA as we would usually say. So class, there are two mechanisms. It could be a direct force or indirect force. Now to introduce you to x-rays with fracture. So class, what you can see here is your radius and ulna. Okay, so this is your fracture. Okay, memory serves me well. This is a lateral view. This is I think this is the lateral view, and then this could be your anterior posterior view of the fracture. So class, in fracture imaging, you need to procure several views to ensure that you will have a complete grasp of the fracture. Okay, now what are the common parts affected? So class, the rib, okay, as you can see, what the arrow are already pointing there, class, on the fracture of the rib. So you can notice that if this is the white line, there's a break on the continuity of the white line. And then class, your femur, which is commonly for the young and middle age. So class, this is your femoral fracture, your hip, by the way, hip and waist for the elderly. For your femur class, you have your young and middle age. So this is your femoral fracture here. As you can see, there is a cut. Okay, this is a complete fracture of your femur, and then the bone is already displaced. Okay, now there are different kinds of fracture. One is your complete fracture. So when I say complete fracture class, the break is across the entire width of the bone in such a way class that the bone is divided into two distinct sections. So notice, okay, so if I'm not mistaken, this is your tibia and your fibula already. So class, notice that this is a complete break between your fibula and your tibia. Okay, just for you to have an idea of the management, so you can see screws and plates here on the right side. Class, the screws and plates are intended to immobilize the bone, and then the screws and plates, class, are placed in such a way that the bone will be able to have the growth normally. Okay, so notice the alignment of the bone. And then class, x-rays later on will be taking successive x-rays or succession of x-rays for us to monitor, or for the doctor to monitor, the progress of the recovery of your patient. Okay, now class, for your complete fracture, especially if it will be an open fracture, the risk class is osteoporosis. Then you have your incomplete fracture. As the term would imply, an incomplete fracture does not divide the bone into two portions, because class, the break is through only a part of the bone. Okay, so if you can notice, this is an incomplete fracture. Okay, this is involving your radius and your ulna. Okay, so this involves your radius here, and this is your ulna. So class, notice that the entire bone is not detached to one another, or the entire bone is not divided into two parts. Okay, there is still a part here which is attached. Hence, the term class is incomplete fracture. Okay, the term for that is incomplete fracture. Okay, then you have your open and closed fracture. So easy for you to remember when I say open. Okay, class, your open, another name for which is compound. Okay, the skin surface over the broken bone is disrupted, which causes an external wound. Okay, class, this is actually an example of an open fracture, but do not think of it like that it will always be like that, okay, wherein there will be a protrusion of some sort. Now, class, as long as the skin is open above the fracture site, it is already considered to be open or compound fracture. Okay, if my patient would have open fracture, what do you think is the risk of my patient? What complication is the risk of my patient? Okay, so class, your patient will be at risk for osteomyelitis. Okay, your patient will be at risk for osteomyelitis. Particularly, we are talking about a patient who will have contiguous osteomyelitis. Now, these fractures are often graded to define the extent of tissue damage. So, class, you have your grades 1 to 3 here. Okay, so grade 1 is a least severe injury, and the damage is only minimal. Grade 2 class would involve skin and muscle contusions. Whereas class, your grade 3, most severe damage to muscle, nerve tissue, and blood vessels. Okay, take note of that. So grades 1 to 3 for open fracture, the higher the number, the higher the chance of resting in peace. Okay, but on this case, class, of course, the more what do you call this? The more grave the procedure, or the more grave the condition of our patient is. Now, closed fracture. So class, the diagram here below would show a closed fracture. Okay, in other words, class, simple fracture. So there is no break on the skin, no visible wound. Hence the term closed or simple fracture. Okay, now class, a fracture is also considered to be non-displaced or stable if the bone would break cleanly but did not penetrate the skin and still maintains your anatomical alignment. Okay, so class, another term again to describe the fracture is non-displaced or stable. So for example, class, if this bone is broken but they are still aligned to one another, and then they are not greatly displaced to one another or moved away from the original site, class, we can say that the bone is non-displaced or stable. So here are other types of fracture. So closed and open, we've discussed, comminuted, and showed to you. Okay, so your displaced fracture, class, is out of alignment already. Now you have oblique. So class, oblique, the shape of which will be oblique spiral, class, would involve somehow a rotating type of injury. Okay, which would include several fragments of the bone broken, impacted. I can show it to you later. Okay, so impacted is here. Green stick, as you can notice, only one side is affected. Then class, the term for this one is comminuted. Okay, several parts here. Then spiral is like a rotating action. Okay, by the way, impacted. Okay, there's a picture for that later on. Okay, so class, this is an example of a comminuted fracture. As you can notice, there are several fragments here. Okay, the bone is broken into several pieces or bone fragments, and this is common among those who are aged, okay, whose bone is already brittle. Plus, the brittleness there of the bone is brought about by your risk for osteoporosis because of the loss, class, of the factor of your estrogen. Okay, this is an example of a displaced fracture. So when I say class, displaced fracture, already out of alignment. So as you can see, this bone is a complete fracture, and then would have displacement. Okay, in other words, it's already out of alignment. So the bones are moving out of the correct anatomical alignment, and this, among the types of fracture, will require immediate intervention. Why, class? Not because of the bone alignment, you could not repair that over the day. Okay, but the problem there is that of the possible cardio compromise. Okay, cardio neuro compromise on the part which is affected. And then other than that, if your patient class would have, okay, if your patient class would have the displaced fracture, the tendency is that there are injured blood vessels surrounding the bone. Okay, there may be injured blood vessels surrounding the bone. So immediate intervention is needed. Okay, then you would have your oblique and spiral fracture. So class, when I talk about your oblique fracture, the fracture is diagonal to the long axis of the bone. Whereas a spiral fracture, one part of the bone has been twisted and then break due to the twisting force applied to the bone. That's why the tendency is that there's a break here, okay, there's another break on the side, another break on the side, as if there's really a spiral action or trauma that happened to your patient. Then you have class your impacted and green stick fracture. Okay, class, this is an illustration of an impacted fracture. Now, what happens in impacted fracture is that the broken ends of the bone are forced into each other or driven forcefully to one another. Okay, class, it's as if one bone is compressing to another bone. Okay, take note of that. Then you have your green stick fracture. So, class, for your green stick fracture, the bone bends and then there is a partial break. Okay, this could be an example of your green stick fracture. Okay, because there is bending of the bone on that side, and then you can notice that there is a partial break. Okay, so plus your green stick fracture is also an incomplete fracture. Okay, these illustrations here are actually showing your impacted fracture. Okay, the red lines here would indicate impaction class. Okay, or the part wherein the upper part of the bone is inserted in the lower part of the bone. Okay, also the same for this one, there was an impact fracture. Okay, however, as a nurse, okay, my clinical eye does not really recognize a fracture here. That's why if you would be specialized on orthopedics, you should be able to know the normal anatomical features of a certain bone, okay, for you to identify whether the finding is abnormal or normal, okay, or whether those are just artifacts. Okay, next you have your pathologic and stress fracture. So class, when I talk about your pathologic fracture or spontaneous fracture, okay, this is the one that I'm showing on the right. Okay, it's not actually the image, but when I say pathologic and spontaneous, you need to remember that this is after minimal trauma to a bone that has been weakened by a disease. A very good example of which is, of course, your friend osteoporosis. Okay, so class, when there is weakening of the bone, okay, due to a disease process, okay, don't worry about okay, that is usually caused by pathologic or spontaneous fracture. Okay? Kindly negate when I said don't worry about that. Okay, you need to be worried about that. As a nurse, okay, you need to be able to identify the risk for fracture already. That's why you need to institute safety measures to prevent the fall of your patient. The next one is your fatigue or stress fracture. So class, for your fatigue or stress fracture, this results from excessive strain and stress on the bone. That's why it's referred to as fatigue fracture. Okay, fatigue. Okay, if you look at this, okay, you're looking at the soles of the feet. So these are the muscles, okay, or these are the bones that are commonly affected. Okay, these are the bones that are commonly affected. So what happens here, class? No, so it's resulting from excessive strain and stress on the bone. Hairline fracture. Sometimes class, they would refer to it as hairline fracture. Hairline in the sense that it could not be easily noticeable. Okay, so class, this type of fracture is caused by overuse, wherein the muscles would become fatigued and unable to absorb extra shock or weight, okay, and would transfer the overload to the bone, okay, or, okay, so the tendency is causing a tiny crack and then would occur when the amount of intensity of the activity is increased too quickly. Again, one trigger of your stress fracture is the sudden increase on the activity. Okay, sudden increase on the activity. Take note of those. Okay, now you also have your compression fracture. So class, for your compression fracture, what is shown on the slide is actually the picture of your vertebrae. Okay, so class, it's actually pointing out in a specific vertebrae where in class there is compression. Okay, so it was compressed. Okay, so these are produced by a loading force applied to a long axis, and usually it is the cancellous bone which is affected by this. On the next discussion, we will be talking about the bone healing process and then some complications of our fracture along with the management. Thank you for your attention.